When it comes to diabetes, most people only focus on cutting carbs, taking medication, and exercising. But there is one important factor that is often overlooked: vitamin deficiencies. This is a serious problem because vitamins not only help promote overall health, but also aid in blood sugar control, nerve protection, and prevent complications. Many people with diabetes are deficient in important vitamins without even knowing it. This can lead to prolonged fatigue, body aches, difficulty controlling blood sugar, and increase the risk of cardiovascular disease and nerve damage. Diabetics are at a higher risk of vitamin deficiency for three main reasons. Firstly, high blood sugar causes the kidneys to eliminate many water-soluble vitamins such as B12 and B9. Second, insulin resistance reduces the absorption of important vitamins such as vitamins D and B12. Third, certain medications, especially metformin, can reduce the amount of the vitamin in the body. If you have diabetes, don't just focus on diet and medication, but pay attention to supplementing with essential micronutrients. Check if you are deficient in any vitamins and make adjustments right away to improve your health, maintain energy, and reduce the risk of complications. 1. Vitamin D. Most people think that vitamin D is only important for bones, but in fact, it also has a big impact on people with diabetes. Vitamin D helps the body use insulin more efficiently, reduces inflammation, protects nerves, supports the heart, and strengthens the immune system. However, many diabetics are deficient in this important vitamin without even knowing it. As a result, they feel tired, have body aches, have poor blood sugar control, and are at high risk of dangerous complications. Diabetics are more likely to be deficient in vitamin D than the average person for three main reasons. First, insulin resistance reduces the absorption of vitamin D, making the body unable to take advantage of available vitamin sources. Second, high blood sugar causes the kidneys to work harder, leading to more vitamin D elimination in the urine than normal. Third, many people have less sun exposure or liver and kidney problems, which reduce the ability to synthesize and metabolize vitamin D. You may be deficient in vitamin D without realizing it. If you're often tired, have bone and joint pain, numbness in your limbs, slow wound healing, or have an infection or have memory problems, it is very likely that your body is deficient in this vitamin. If you have 3 or more signs, get tested right away to avoid serious complications. A study in the UK found that people with type 2 diabetes with low vitamin D levels had a 50% higher risk of neurological complications. Mr. Mark, 62 years old, has been suffering from diabetes for more than 10 years and often suffers from pain and insomnia. After testing, the doctor found that he was seriously deficient in vitamin D. After only 3 months of supplementation, he completely reduced pain, slept better, and his blood sugar levels were also more stable than before. To supplement with vitamin D effectively, you can take advantage of the sun by sunbathing for about 15 to 20 minutes a day in the morning or late afternoon. If you can't be exposed to the sun long enough, increase foods rich in vitamin D such as salmon, sardines, eggs, sun-dried mushrooms, and cod liver oil. If necessary, you can use supplements in the right dosage, but it is necessary to check the level of vitamin D before taking it to avoid excess of the vitamin, which can harm the kidneys. Some bad habits can reduce the absorption of vitamin D that you should avoid, such as consuming too many processed foods, eating a lot of sugar, drinking alcohol, and using low-quality vegetable oils. These factors can reduce the effectiveness of vitamin D, causing the body to absorb it poorly. If you want better blood sugar control, don't skip vitamin D. Just a small change like taking the right supplements can help improve overall health and reduce the risk of serious complications. Check now to make sure your body is not deficient in vitamin D. 2. Vitamin B12. Did you know? Vitamin B12 deficiency not only makes diabetics tired and numb, but can also cause permanent nerve damage. If you're experiencing these signs, check right before it's too late. Vitamin B12 is an important micronutrient that helps protect nerves, prevent diabetic neurological complications, produce red blood cells to prevent anemia, generate energy, improve memory, and support the heart. However, many diabetics suffer from severe deficiencies without realizing it, especially those who have been using metformin for a long time. There are many causes of vitamin B12 deficiency in diabetics. Metformin reduces the absorption of B12 in the small intestine, causing about 10 to 30% of users to be deficient without knowing it. High blood sugar causes damage to the intestinal mucosa, reducing vitamin absorption. A diet lacking foods rich in B12 such as meat, fish, and eggs is also a common reason, especially for vegetarians. In addition, age reduces the absorption of B12, making older people more susceptible to deficiency. Signs of vitamin B12 deficiency can appear silently, including numbness of the limbs, prolonged fatigue, memory impairment, dizziness, muscle weakness, and heart palpitations. If you experience 3 or more signs, you may be in serious deficiencies. Prolonged B12 deficiency can cause nerve damage, loss of sensation, muscle weakness, increased risk of stroke, anemia, and even affect memory, causing premature dementia. Linda, 65, lives in Canada, has been diabetic for more than 20 years and often suffers from numbness of the limbs, dizziness, and insomnia. Initially, she thought this was a complication of diabetes, but when she went to the doctor found out that she was severely deficient in vitamin B12. After supplementing, after just a few weeks, she felt better. Relieved numbness and her sleep also improved significantly. To supplement with vitamin B12, you can fortify foods such as beef liver, seafood, salmon, eggs, and cheese. If the diet is insufficient, supplements such as Jarrow Formula's methyl B12 or Thorne Research methylcobalamin can be taken. It is recommended to drink in the morning or after meals for better absorption. If the digestive system is poor, use a lozenge under the tongue to be absorbed directly by the body. Some habits that can reduce B12 absorption that you should avoid include drinking alcohol, eating a lot of processed foods, and taking long-term stomach acid-lowering medications. These factors can reduce the absorption of vitamins, causing the body to be deficient even with supplements. If you have diabetes, check your B12 levels regularly. B12 deficiency can cause serious nerve damage, but fortunately it can be easily corrected with timely supplementation. Take the initiative to protect your health right now. 3. Vitamin B9. Vitamin B9, also known as folate, is an essential micronutrient that helps stabilize blood sugar, protect nerves and blood vessels, but is often overlooked. Unlike vitamin B12, folate is not stored by the body for a long time, so regular supplementation is needed. If you are deficient in folate, diabetics are at high risk of neurological and cardiovascular complications and memory impairment. Diabetics are more likely to be deficient in folate due to a variety of causes. High blood sugar increases oxidative stress, causing the body to metabolize folate poorly. The drug metformin, which is popular in the treatment of diabetes, also reduces the absorption of folate. In addition, because diabetes increases the number of urinations, the body loses many water-soluble vitamins, including folate. If the diet lacks green vegetables, lentils, and animal liver, the risk of folate deficiency is even higher. Folate deficiency can cause many symptoms such as prolonged fatigue, pale skin, easy bruising, memory impairment, body aches, numbness of the limbs, and prolonged stress and anxiety. If you have 3 or more signs, you may be suffering from a serious deficiency. Folate deficiency increases the risk of nerve damage, stroke due to high homocysteine levels, and immunodeficiency, making the body more susceptible to infections. David, 58, who lives in the United States, has been suffering from type 2 diabetes for more than 10 years and often suffers from numbness in his limbs, forgetfulness, and fatigue. After testing, the doctor found that he was severely deficient in folate. After adjusting the diet and supplementing with folate, after only 1 month, the numbness of the skin decreased markedly, memory improved, and the body was less tired. For an effective vitamin B9 supplement, eat plenty of folate-rich foods such as beef liver, spinach, lentils, asparagus, and avocado. If the diet is insufficient, supplements such as Thorne Research 5-MTHF or Pure Encapsulations folate can be used. It is recommended to take it in the morning or at noon for better absorption and avoid taking it with metformin as this drug can affect the absorption of folate. Some habits that can reduce the absorption of folate that you should avoid such as consuming processed foods, drinking alcohol regularly, and eating too much refined sugar. If you are taking metformin, check your folate levels periodically for timely replenishment. If you have diabetes, don't let your body be deficient in vitamin B9. This is an important nutrient that helps protect nerves, reduce the risk of stroke, and improve overall health. Take the right supplements to control the disease more effectively. We've learned about 3 vitamins that are important for people with diabetes. Vitamin D helps support insulin, protect nerves, and the heart. Vitamin B12 prevents nerve damage, improves memory and energy. Vitamin B9 stabilizes blood sugar, protects blood vessels, and prevents anemia. Properly supplementing with these vitamins can help control blood sugar more easily, reduce the risk of complications, and improve quality of life. But knowledge alone is not enough. It is important to apply it in practice. Before taking vitamins, check your blood to see if your body is deficient. If the level of deficiency is severe, it may be necessary to supplement with high doses for a short period of time, then maintain with natural foods. Make sure your daily diet includes vitamin-rich foods such as salmon, eggs, sun-dried mushrooms, beef liver, green vegetables, and lentils. If you are a vegetarian or cannot eat enough of these foods, you can take appropriate supplements. Avoid processed foods, alcoholic beverages, and refined sugars as they reduce vitamin absorption. If the food is not provided enough, dietary supplements can be considered. Vitamin D3 plus K2 helps absorb calcium more efficiently. Methyl B12, 5,000 micrograms, is a good choice for metformin users. Methyl folate, 800 to 1,000 micrograms, helps protect the heart and nerves. Vitamin D should be taken in the morning or noon for good absorption by the body. Take B12 in the early morning to avoid causing wakefulness at night. And do not take folate with metformin because it can affect absorption. In addition to vitamin supplements, it is necessary to maintain a healthy lifestyle. Sunbathe for about 15 to 20 minutes a day to increase vitamin D synthesis. Get enough sleep and manage stress, as prolonged stress can deplete vitamins in the body. Proper vitamin supplementation not only helps control diabetes, but also protects the nervous system, heart, and boosts energy. Apply now to improve your health every day. So we have discovered important vitamins that help diabetics manage the disease more effectively. Vitamin D supports insulin, protects nerves and the heart. Vitamin B12 helps prevent nerve damage, improve memory and energy. Vitamin B9 stabilizes blood sugar, protects blood vessels, and prevents anemia. If you have diabetes, don't skip checking and supplementing with these essential micronutrients to avoid dangerous complications. Proper vitamin supplementation not only helps control blood sugar, but also improves quality of life. Check your vitamin levels, adjust your diet with nutrient-dense foods, and use supplements as needed. Don't forget to combine it with a healthy lifestyle, regular exercise, and sunbathing for the best absorption of vitamins by the body. If you find this video useful, press like, share to make more people aware of this important information. Don't forget to subscribe to the channel and turn on notification bell so you don't miss the next videos about health and nutrition for diabetics. Thank you for watching. See you in the next video.